So I'm gonna knock on the door, walk in, close the door to provide privacy. I'm gonna wash my hands. I'm gonna verify the patient with my physician's orders and TAR. So I have Bernie Payne, 9/23/1981, allergies, penicillin, and SOFA. I would either ask the patient their name and date of birth. Since Bernie Payne can't talk, I will compare it to the wristband. All right. Then I would assess the patient's pain. If he's in any pain, I'll give him medicine, and then come back when the medicine has officially taken place or effectiveness. All right. Now I'm going to compare my physician's orders. Oh, I need to introduce myself too. Say, hi, my name is Alana Delgado. I'm your student nurse, and I'm going to be doing your sterile dressing change today. Okay. Now I'm going to compare my physician's orders. So I have Bernie Payne, 9/23/1981, with my TAR. Bernie Payne, 1923/1981, penicillin and SOFA's allergies. We have sterile dressing change, daily use, 0.9 sodium chloride to cleanse wound. Then to the TAR, we have use normal saline, wet to dry dressing change twice daily. All right, so that we verified the patient, we verified the orders. Now I will put on some gloves and assess the site. I would put the patient up to working position. Make sure the patient's comfortable, have privacy. I already gave him his medication. I already put the biohazard bag here. Actually, before I do this, I'm gonna verify my saline, just because I don't want to leave the wound open while I'm doing it. It's preference. So I'm gonna verify my normal saline with the TAR. So we have normal saline. Dose is as much as needed. Time is now. Route is topically. Reason is to clean wound, and medication is 0.9 normal saline. So we have our second check. We have an individual is Bernie Payne. So then we have our second check. We have dose is as much as needed. Time is now. Individual is Bernie Payne. Route is topically. Medication is normal saline, and reason is to clean the wound. Then we have our third check. We have dose is as much as needed. Time is now. Individual is Bernie Payne. Medication is normal saline. Reason is to clean wound, and route is topically. I would check the expiration date, make sure it's not expired, and I would change the bottle according to facility policy. All right. Now I will put on my gloves and check the site. I will pull the ABD away from the patient so they don't get like grossed out and stuff. So we're gonna look for coca. We're gonna assess for coca, which is color, odor, consistency, and amount. So I would look at that and I'll throw it in the hazard bag. And I'll do it for all of them as well: color, odor, consistency, and amount. Color, odor, consistency, and amount. Color, odor, consistency, and amount. Now I can take my gloves off. Put in the hazard bag. I'm going to wash my hands again and set up my sterile field. So I have my sterile drape. I'm going to use the 1-inch border. Use the 1-inch border. keep my sterility. Open my ABD. There's a trash can there. Open my 4x4. I would get a new one. It's trash. Can you pause it? Oh. I had to go get a new one. Okay. So I had to go get a new one. And then I'll have my bowl, which would be in a plastic container, and I would put it right there. Now I'm going to take the solution. I already did my 3 checks. I'm going to put my hand over the lid. I'm going to lip it. I did have a bowl. Lip it. And put it just enough as needed. Now I'm done with this. And now I'm going to put on my sterile gloves. Put on my sterile gloves. And take this. Step back. My thumb. There you go. These are really big. Okay. Take this. My thumb away. Alright. Now, I'm gonna put 2 ABDs, gauze, silicone. Damn. Stuff them in there. I will make sure they're packed in there and that it's not laying over the skin, because that could do more damage than do more harm than good. Then I'm gonna grab these 2 ABDs and lay it on top. Gauzes. Then I'm gonna grab my ABD, lay it on top. And at this point, if there was no drainage or anything, I could take my gloves off to tape. Then I'll apply 3 things of tape to secure it, if it wants to work. I'm no longer sterile. 1, 2, would put my gloves in the biohazard bag. I put the biohazard bag wherever the facility policy would put them. I would wash my hands. I would reassess my patient, make sure he's not in any pain. I would put him in a comfortable position. I would document, wash my hands, and that's it.